Hello, everyone. Welcome to S-Series, a podcast where we discuss everything healthcare. I thank you for subscribing to my channel, and if this is your first time, kindly click the subscribe button below so you can be notified when I upload interesting new episode. I remain your host, Sonny Clement. Today, we're going to be discussing the topic 10 challenges hospitals are facing in Nigeria. Hospitals in Nigeria face a range of challenges that contribute to their failure or underperformance. The failure of hospitals in the country can be attributed to several factors. In this podcast, I'm going to be sharing with you 10 of such key factors.
This podcast is sponsored and brought to you by HealthShare Integrated Solutions.
Number one is inadequate funding. The Nigerian healthcare system suffers from chronic underfunding. The budget allocated to healthcare, for instance, is often insufficient to meet the needs of hospitals, leading to shortages in essential supplies and equipment and medication. Apart from that, many hospitals operate in dilapidated buildings with outdated equipment due to a lack of funds for maintenance and modernization. This significantly hampers the quality of care that they provide, and this is peculiar, especially to public institutions. I mean, hospitals owned by government. Number two is poor management and governance. This is very key, as corruption has enveloped almost every facet of the economy. Mismanagement and corruption within the healthcare system siphon off resources that should be used for improving hospital facilities and services. Funds intended for healthcare are often diverted for personal gain or misuse. Number three, shortage of qualified healthcare personnel. Nigeria currently suffers seriously from brain drain. Nigeria faces significant brain drain problem with many qualified healthcare professionals migrating to other countries in search of better working conditions, pay, and opportunities for professional development. Apart from that, there is also a shortage of well-trained healthcare workers within the country. The training facilities and educational institutions are often under-resourced, leading to workforce that is not fully equipped to handle demands of modern healthcare. Number four is working conditions. Healthcare workers in Nigeria often get underpaid, which affect morale and productivity. Many doctors and nurses and other medical staff are forced to take on multiple jobs and side gigs to make ends meet, which can detract from the quality of care that they provide. Apart from that, many hospitals lack basic amenities such as clean water, electricity, and sanitation, making it difficult for healthcare workers to perform their duties effectively and safely. Number five is supply chain issues. Hospitals frequently experience shortages of essential medications and medical supplies. These shortages are often due to insufficient supply chain management, corruption, delays to procurement process. In addition to that, the proliferation of counterfeit drugs in the Nigerian market also undermines the effectiveness of treatment and can lead to complications, thereby eroding public trust in the healthcare system. Number six is limited access to modern technology. Many hospitals in Nigeria rely on outdated or non-functional medical equipment, which hampers the diagnosis and treatment of patients. The lack of modern technology also limits the ability of to perform advanced medical procedures. Even when modern equipment are available, poor maintenance practices often lead to frequent breakdowns, further exacerbating the challenges faced by hospital. Number seven is overcrowding and high patient to doctor ratios. The number of patients often far exceed the capacity of hospitals, leading to overcrowding, long waiting times, compromised care. This is especially true in urban areas where population density is the highest. The shortage of healthcare professionals means that doctors and nurses are often overwhelmed by the number of patients they need to attend to, which can lead to burnout and errors in patient care. Number eight is inadequate health insurance coverage. With limited insurance coverage in Nigeria, most people have to pay for healthcare services out of pocket. This can lead to financial strain for patients and reduced hospital revenue. And many patients avoid seeking care until it is absolutely necessary. And this is an area the government needs to really really intervene, because currently, I think in Nigeria we just only have 6% of our population insured, which is grossly low compared to other countries, African countries like Kenya, that you have up to about 40-45% of their population insured, and in South Africa we have more than 65% of their population insured. It's such a shame that a country like Nigeria will only have only 6% of our population insured, and subjecting Nigerians to fend for themselves when either themselves or our family members has got a health challenge, where they have to source for the funds and they've got to pay out of pocket. This is very unsustainable, you know, and it's also very unattractive to investors and investments in the healthcare space. The National Health Insurance Scheme has very low penetration, especially in the rural areas, leaving many without any form of coverage at all. Hospitals often struggle to recover costs, even from private HMOs, which affect ability to maintain operations and improve services. Number 9, cultural and society challenges. Due to past experiences of poor services, many Nigerians have deep-seated mistrust in the healthcare system. This mistrust leads to some seek alternative treatment to avoid hospitals altogether, further straining the system. In fact, most people do not even go to public hospitals. They've got to they patronize mostly private hospitals, and generally altogether, some people even just fly out of the country because they do not trust the system. These are some communities. Traditional medicine and cultural beliefs, and even religious beliefs, can lead people to avoid formal healthcare services, also known as divine healing, leading to late presentation of very bad cases and higher mortality rates at the end of the day. Number 10 is inadequate government support and policy implementation. Even when policies are in place to improve healthcare, the lack of enforcement and follow through by government bodies means that these policies often fail to have intended impact. Frequent changes in government and political instability can also lead to inconsistent healthcare policies and a lack of continuity in healthcare reforms, which hampers long-term improvement in the healthcare system. Um, Generally, the failure of hospitals in Nigeria is a complex issue, influenced by inadequate funding, poor management, and a host of other challenges. Addressing this problem will require concerted effort from government, private sector, healthcare professionals, and the population at large. Significant investment in infrastructure is very key. Human resources is very key. Healthcare management, technical know-how is very key, along with robust policy implementation that are essential to transform the Nigerian healthcare system and improving the quality of care available to its citizens. That's all we have for today. Thank you for tuning to Health Series. We hope you found today's episode insightful and valuable. If you enjoyed the conversation, don't forget to subscribe, rate, and leave us a review. It really helps us to reach more listeners like you. Be sure to follow us on Facebook, Instagram, and TikTok for updates, and to join our growing community of S-Series. If you have any questions, topics, or you'd like us to cover, guests you'd like to hear from, feel free to reach out to us. We would like to hear from you. Until next time, stay informed, stay healthy, and keep exploring the world of healthcare with us. Thanks for listening.
This podcast is sponsored and brought to you by HealthShare Integrated Solutions.